I was actually only giving you the first part of my answer. Our brains work on chemistry. So there are some molecules, and these molecules, proteins, they move around and they send signals around, and it's incredibly energy efficient. So we send signals that is like one electron, instead of sending a pulse that has billions of electrons, which is what we have to do when we want to do it with a chip.
Hi, Stefan.
Hi, nice to meet you.
Joe Glover.
Nice
to meet you.
Matt Lavoie, nice to meet you.
Hi, okay.
Yeah.
We're going to see some brains today?
We do. We have some ready for you.
A brain.
So medium are here, larger over at the table.
My aprons at home go around the front. So, how'd you get into this line of work?
My father worked as a homicide detective for way over 30 years.
Oh.
And growing up, my dream was always to be a forensic pathologist and work cases with my dad. Like the ultimate dream. But then during medical school, I walked into a research lab studying Alzheimer's disease. And I'm like, okay, that's what I want to do. And then it was pretty quick that I decided I stay in pathology, but I also do research. And so I became a neuropathologist.
Now this is a whole brain.
Yeah, this is a whole brain, and we have half brains in here, but I just wanted you to see a whole brain. So here, you can please feel free to touch it.
I see it.
Yeah,
Well,
you can also hold it.
Should we do touch the animals?
Really?
Yeah. Wow. So you get an idea. I always want people to get an idea what you have between your ears. Right? I mean, that's average size of a human brain. You have your two hemispheres.
How much does that weigh?
That's probably 1,300 grams. So that's the average weight of the brain. And when you think about, when we talk later about neurodegeneration, you lose about 15 to 20% of that weight. So you lose like 200 grams. So when you just look at this, you see how much you would lose when you have neurodegenerative disease.
How many brains per year do you remove here, and where do they come from?
Yeah, so we get about 60 to 80 brains a year that are donated to the brain bank. And what we have is, we have a really good outreach to the community. So we go to Alzheimer's self-help groups, Parkinson's groups, and also talk to patients. I talk to families.
But it's also really important, to be getting brains from healthy individuals so we have something to compare to. So it's very challenging to do that, but very important for the studies.
So is that a solicitation?
It wasn't a personal request.
Okay, just checking.
But we have the paperwork ready for you.
Yeah,
so
right.
if you feel ready afterwards, you can just sign.
Most people tell me I have an abnormal brain. So. You may not get my brain, but obviously a lot of people donate brains to you. What motivates them to donate their brain?
Yeah, so we've seen, and as I said, I talk to families a lot, and really what motivates them the most is they want to know what their loved one had. And with the autopsy, they get a final answer. Because often you have a clinical diagnosis, but they don't know what their loved one had. And it really helps the families that accompanied their loved one for 10 years suffering from a disease to definitively know what was going on.
So typically when you do a study, a medical study, how many brains would you look at? I mean, how many do you keep on site, and how many would typically be looked at in a study?
So in the freezer farm and in the brain bank right now, we have close to 600 brains. 600? Yeah.
Pretty frightening for people to see this. More frightening than the brain.
Yeah, so this is where we store the leftover from what we've cut. What you saw on the table. This is where it's stored at 4 degrees, and we can always go back. If we have more questions, we can go back.
So the College of Medicine is a really big place, right? With hundreds, if not thousands of researchers. Does anyone from elsewhere in the College of Medicine or the Health Science Center come and say, I need to know this about brains, can you help me?
Yes, that's our mission. So we supply them with the brains, but it's also that we talk to them first and make sure they understand what we can do and what we can't do. And then they get the tissue they need for their research.
Ah, great, lights up, just like in Publix. Have you discovered anything that might help you prevent some of these diseases from developing?
I think one of the key takeaways is that, that there are questions that only human brains are going to give us the answers to as we're trying to solve these diseases and trying to come up with therapies and to treat patients and improve the quality of their lives. There are certain things that we're not going to get out of cell models or out of mouse models, and we're going to have to go to the actual disease and have the human tissue to get the best understanding possible. And that's why the brain bank and access to the brain bank is so critical for advancing our research.
I congratulate both of you because you have exceeded the coffee quality at Hypergator. The last Cup of Joe that we did, we talked about Hypergator and the amount of power that it uses. How much power do you know does the brain consume or generate? Or
Well, it is certainly a lot. It's all the sugars that we eat, right? And so the sugar gives the brain the power.